My name is Dr. Nichole Butler, and I am a senior gynecologist. I get that question a lot, actually, because years ago, women started earlier. Now we start doing the pap smear at age 21. So it's not necessary for a young lady, even if she is sexually active, to come in for a pap smear. She can come in for screening for sexually transmitted diseases, but a pap smear is not necessary until age 21. So a pap smear is a screening test for cervical cancer. As you know or may not know, cancer is abnormal cells. So when we are taking a sample of the cells, we're looking at them to make sure they are normal. That's what a pap smear is screening for. HPV is very important. HPV is human papillomavirus. It is a virus very similar, or you can think of it like we think of a cold virus, but it is passed sexually. And what we know now is that HPV is the virus that causes cervical cancer. So we screen for HPV to identify women that are at increased risk for cervical cancer. As a gynecologist and as someone that sees cervical cancer and the damage that it does, I recommend that everyone get the HPV vaccine. I think that pediatricians should be giving it so that we start at a younger age before people are sexually active. As we know, this virus is sexually transmitted. I am a big fan of the HPV vaccine. The HPV test is the test that we do at the same time as the pap smear. It is not a separate test, as in you have to do separate things. We do run two different tests, the pap smear, which, as I stated before, screens for cervical cancer, and the HPV virus. That is a different test, but we do them all at once on the woman at the time of the pap smear. So I recommend, or it is recommended by the American College, that everyone get the HPV test after age 30. Before age 30, you can get it, but generally we do what's called just the pap smear, and if it's abnormal, we run the HPV screening test at that time.